Mental health services are set to receive a $206 million boost. The federal government will include the extra money in next week's budget directed at early psychosis intervention. For more, I'm joined by mental health expert for young people particularly. He's also former Australian of the Year and Executive Director at Orygen Youth Mental Health, Pat McGorry. Pat, thanks for your time as always. A couple of $100 million here for early psychosis intervention, $206 million. Early psychosis youth services, why is that important? Tell our viewers.
Well, early intervention for psychotic illnesses like schizophrenia is where I started my career back in the early 90s. And what we showed was that even these very potentially serious illnesses, if you detected them early and treated them intensively as soon as they were recognised, the outcomes were dramatically better. And this was a model of care that went around the world in the 1990s and the 2000s across Europe and North America. And we were slow to embrace that in Australia. About 10 years ago, we started to build a network of these services, but they've kind of languished a bit and had a checkered sort of level of support over the last decade. But today, the Prime Minister stabilised that program and even extended it into 2 states where it is not currently in place, ACT and Tasmania. So we've really got a secure future for this highly effective model of care. And its wider importance, Kieran, is basically that it's the platform on which we can tackle the missing middle, which you and I have talked about in the past. This very large group of young people who aren't helped enough by Headspace, which is a primary care service. Headspace is a great entry channel and is able to treat milder problems, but these are more complex problems. And it's not just psychosis, it's a range of other conditions, complex mood, eating disorders and so on, borderline personality, these sorts of conditions. And there's just nowhere for those kids to go. So we have to expand this platform. Prime Minister stabilised.
So basically, Pat, it's somewhere between the primary care of Headspace and hospitalisation. Is that what we're talking about?
That's it. That's what the missing middle is. And so the Prime Minister's made a commitment today to fill that gap, stabilised our initial investments in this area, extended them, and I think this is a foundation to build on as we recover from the pandemic. So in the election period, we would hope that this would go further, and we would see there's many more communities basically being offered access to this model of care as we go forward.
We're talking about more than 4,000 young people between the age of I think as young as 12 and 25 that might benefit here with early intervention with any signs of psychosis. And as you've said to me and our viewers on many occasions, that early intervention is what's key here.
Yeah, and this gives you a return on investment too, because these young people, the Prime Minister today met a number of young people who have been through this experience and have actually recovered extremely well. And I think he was incredibly interested and impressed with the effectiveness of this program. So I think that will give him confidence, I think, on it further going forward. Each one of these centres will be able to treat at least 1,000 young people a year. So we have 8 of these across the country now. That's a definite step forward, but we need to go further.
Because also it takes the heat off Headspace, which I know is heavily in demand itself. That people struggle to get a booking at Headspace because they're having to manage the intensity of these young ones that we're talking about in today's context.
Yeah, it'll take the pressure off the back end of Headspace, as you say, and it'll actually provide care to a whole bunch of young people that currently don't have any care unless they get so extremely ill that they end up in the emergency department, which no one wants to see happen.
No, that's for sure. Now, before you go, we know the election's around the corner. Have you received encouraging noises from the other side of politics as well? Because they could well be in government in the not too distant future.
Well, as you know, I and my colleagues have always adopted a bipartisan approach to mental health, and I think the major parties have actually respected that. So We just, as the Prime Minister said today, all we ever say is what is actually needed, and we provide blueprints of things that will actually work, and it's up to the politicians to decide what they want to do with that information.
Okay, Pat McGorry, on a big day for that area and that treatment that you have dedicated your life to. I appreciate your insights. Executive Director at Orygen, Mental Health, and also, of course, former Australian of the Year, Pat McGorry there.